Hello and welcome to Pulse Check with Archer Nursing, where nursing comes to life. In this podcast, you give us 15 minutes of your day, and we'll take one complicated nursing topic and make it easy. Ready for nursing to be fun? I'm Morgan, and welcome to a special episode of Pulse Check, where we are going to talk about potentially one of your next steps in your nursing career. I know many of you have reached out and said, hey, should I apply to nurse practitioner school? Should I go and be a nurse practitioner and advance my career? Many of us went into nursing school kind of assuming that that was going to be the path we took, or maybe that was our first plan. I know for me, I always thought, I'll be a nurse for 5 years and then I'll go and be a nurse practitioner. But there's a lot we need to consider first. So if you are in this phase where you've been a nurse for a little bit, or maybe you're still in nursing school and you're not sure if you want to consider that role, we are welcoming our Director of Advanced Practice, Hiva Kolodrubetz, to talk to us today about what we want to consider before applying to NP school. Welcome to the podcast, Hiva.
Thank you for having me, Morgan. I love talking to you and I love your podcast. I listen to it myself, so I'm excited to be here.
Fantastic. Well, give us a quick little intro on your background, what you do for Archer now, and then we will jump right into what that journey to being an NP looks like and what we should think about before we apply.
Yeah, absolutely. So I'm a family nurse practitioner. I've been a family nurse practitioner for a little over a decade now. I hit my 10-year mark this summer. You always have to do the renewal and you're like, oh, wow, it's been 10 years. Okay. And prior to that, I was a pediatric nurse. Mostly my background started in community health. And I had no idea what a nurse practitioner was before I went into community health. I always had this notion of just nursing and I want to be a bedside nurse. But a lot has changed in the healthcare industry. And I think now people know what a nurse practitioner is. Whereas when I graduated, I had to explain it a lot. So it's great to have this conversation. I'm really excited because I think it is trending, if we want to say it that way. And I love really talking about, well, what is a nurse practitioner and is it right for you? Because it's not right for everyone. And so my background starting community health, really got into internal medicine, pivoted to cardiology, ran a structural heart valve clinic, which I loved, and then pivoted back to primary care, pediatric endocrinology, and that's what I'm in now. So with my role with Archer, I get to really help educate the next generation of nurse practitioners, and I see a lot of common trends. So I'm really excited to talk about those things today.
Really cool. I love it. And I love how your career as an NP has spanned from, that primary care, really one-on-one patient experience, to some leadership experience running a clinic, to some education experience working as the Director of Advanced Practice at Archer. So there's a lot you can do, both as a nurse and as a nurse practitioner, as an advanced practice
Oh,
nurse.
100%.
So it's really cool. I feel the same way whenever people are talking to me like, oh, I'm burned out from being at the bedside. I'm thinking about doing something else. I'm always like, don't leave nursing. There's so much in nursing that you can do that's really fruitful. It's one of the best things about the nursing profession as a whole, if you ask me, is just the choices that you have are almost unlimited.
I completely agree with you. And that's why it was one of my top reasons for going into nursing, because I'm someone who is super indecisive. I've always been indecisive about my life. And I said, I want a career where I can try different things. Like I can keep it interesting for myself. I can really use my brain and problem solve and critically think. And that's what nursing has been. And every role that I've had, I've been able to change processes. Even in community health as an RN, I was able to change the processes there to really help improve the care for our patients. And that's who nurses are, right? We're all just problem solvers. We're all leaders, and we need to really be in those rooms making those decisions for our profession. So nursing is wonderful. Yeah.
I love it. I love it. Okay, so for our listeners who are considering, hey, should I go to NP school? I think the first kind of bucket that we decided we wanted to talk about was role clarity and really getting honest about why you want to do this. So maybe we can start, Hiva, about why you wanted to be a nurse practitioner and how that journey unfolded for you. what does your day to day look like as you've gotten into the career?
Yeah, I think role clarity is really important because I think a lot of students are feeling the pressure to go into NP programs and they may not really know what that day to day looks like. So my current day to day looks very different from what my day to day looked like in a internal medicine clinic, in a cardiology clinic. So the setting is really important. But the core thing about being a nurse practitioner is really having that responsibility for your patient. So as a nurse, you have standing orders, you are responsible for that patient, but really the clinician is making that final call. There is a large responsibility as an advanced practicing nurse to really be that final decision maker. Now, if it's a complicated situation, of course, you're going to elevate that situation, but you have to understand that you are calling the shots as a nurse practitioner, and you really have to be comfortable with that. It doesn't mean that you have to know everything right away, but you have to be comfortable with that gravity of responsibility. And I think that's really important. But I'm really excited to talk about all the different roles you could have as a nurse practitioner. And one thing that you and I have talked about, Morgan, is do you have, like, as a student, do you have that desire to elevate what you are learning, what you're doing in the clinic? And that's really what started for me. I was in community health. I started getting into these leadership roles. I started having my own schedule where patients would come in and see me as the nurse on the unit. And they see me for their blood pressure, they'd see me for their vaccination visits. And I really started to feel comfortable with, like, well, actually, why are you on this blood pressure medication? I think you'd respond better to this blood pressure medication. And I'd go and talk to the clinicians. They'd be like, yeah, that's great. And they're like, just ping me a message and I'll put the order in. And then I started to really think about it. I was like, well, how about I start to do this myself, right? Like, I'm really enjoying this, getting a little deeper into the why, getting into that critical thinking. And I want to take care of my whole patient without having to always go check with someone about what I want to do. So I think that's where, again, it's you have to be really mindful of having that responsibility for the patient because you're no longer checking with someone and someone else is putting in the orders. You're putting in the orders. And I think that's
Taking
a big
orders.
difference there. Yeah.
Yeah, and I think that that desire for more autonomy in diagnosing, prescribing, et cetera, that is a really great reason to go to nurse practitioner school because that is what your role will entail. There will still likely be a lot of direct primary care. There are direct patient care, I should say. So I've had some students say, like, I'm just wanting to escape the bedside. I'm wanting to get away from like direct patient care. And that might not be the best reason to consider going back to NP school because there is still a lot of that like bedside care, direct patient care. But as Hiva said, the autonomy in the diagnosing and prescribing, if that's like one of your reasons, that's a pretty good reason to want to go
Yeah,
back.
I think it's scary when students say they're just burnt out from the bedside and that's why they want to go to NP school. Because I think the core of being a nurse practitioner is our patients, right? I'm at the point in my career where I can no longer sustain 40 hours a week of patient facing. That was something I could do for a long time, but now I have young kids and I just don't have the energy for that. So I've
Yeah.
pivoted, but at the core, what really lights me up is helping my patients, right? And really taking that experience and bringing it back to my students and saying, oh, yeah, like I saw this in
Yeah.
clinic last week. Let's talk about this. Let's talk about this experience so that when you see it in clinic, you know what to do. But the core of my job is really that one to one with my patient. That's where I get the most satisfaction. So if you're just done with patient care, then the NP track is not the right track because that is the essence of what we do as nurse practitioners.
And that's okay. If what he was saying, you're like, yeah, that's me. I am actually done with patient care. That is okay. There are a lot of other paths. So I've also heard students say, like, okay, well, it's the only way to advance. And I'm feeling kind of stagnant. I'm ready for the next step. So, if that resonates with you, Hiva, what are some of the other advanced practice roles out there? Because that's not a good reason to go to NP school. Is like, oh, well, it's my only option. It is not your only option. There's a lot of career paths as an advanced practice
I agree.
nurse.
And I think students get confused because there are so many different paths. And honestly, like, I don't think I even saw all the different paths until I got into the education role. And then I started to teach students about their options. And I was like, oh, there's so many options. Like, once I really got into it, it's like there's nurse informatics, there's like, so you have to, what I would ask students to look at is what is it that you want your day to day to look like? And what is it that's burning you out? Is it the patient care or is it the process? Are you getting really tired with what's happening in our healthcare system with administrators dictating how nursing care should look like? And if that's something that you're really passionate about, you have a lot of experience in, then maybe you would do really well going into something more administrative where you can actually make an impact in those processes, right? Like we have that experience. How can you use that experience to make it a better place for yourself and the person coming behind you, right? Because we don't want to just escape from this healthcare system. We are gonna go through the healthcare system, our loved ones, our family members, this is the society that we live in. Let's let's take a look and say, "Okay, what is it that's burning you out? Do you feel like it's unsafe practice? Do you wanna really tackle that issue?" Right? And what do you need to tackle that issue? Do you need to go back for a degree in education? Do you need to go back for a law degree? I mean, I see a lot of RNs with JDs who make a huge
Mhm.
impact. It's great, and then you can work for
That
the hospital
full nurse
system.
consulting,
Oh, yeah.
huge.
You can work for the
Yeah.
hospital system and say, "Hey, this is what I think we need to be doing, not only to improve patient care, but also decrease liability," right? And the other big thing I see a lot of RNs going back for their DNPs, you don't have to be a nurse practitioner to have your DNP. DNP is really about, and Morgan, you can speak a lot to this because you have your DNP, but it's really about taking more leadership roles. And so that's something where you can apply your nursing experience to that degree and really make a big impact. So look at what's burning you out and how can you make it better for everyone, including yourself, but really for our community. So that would be my advice.
I love that, Hiva. It's the nugget I'm taking away. It's like, what do you like from what you currently do? Let's make sure we bring that with us. What could you maybe do without? And think about the role where your day to day is really going to fulfill that. So get really clear on those options, those
Yeah.
roles. That role clarity was kind of our first
Yeah.
bucket. And I love this takeaway that, the direct patient care, the autonomy, the diagnosing and prescribing is really going to be your bread and butter. So if that is what you're sounding right now, like that lights me up. I really want to do that, Morgan. That is in line with my goals. That would be a good reason to move forward. You are clear and move forward into that NP track. But the second thing that I want to bring up is, just because you're like, yeah, that's what I really want, are you ready to take that next step and apply? And the second bucket Hiva and I talked about was kind of checking your clinical foundation and saying, am I ready for this next step? And if I'm not, what can I do to get ready? So, Hiva, I know you've worked with a lot of new graduates and clinical students as a clinical instructor coming in. What would you say about, preparing yourself to take that next step, getting ready for provider level thinking? How does a student know if their foundation is solid and they're ready to go for that next step?
100%. I think that's a really great question. You're never going to be 100% ready is what the final bullet point is, because there's a lot of learning to be done, right? There's a reason why we go back and there's a reason why we're advanced practicing registered nurses. You're not going to know the why. You're going to learn the why, not only in your didactic training, but in those first few years of practice. So that's really important. But how do you know you're ready is when you're thinking, okay, I'm seeing the patterns, kind of what you pointed out, Morgan. I'm seeing these patterns, kind of what I described with my patients coming in for those blood pressure checks. So you're not just checking off a box, and you might be doing this because you're burned out. So it's okay. You can walk back from that and be like, hey, let me remind myself why I went into nursing in the first place, really bring out the joy in my day again, really working with my patients. but really understanding, okay, is this something I'm interested in? Is this something that I'm gravitating towards learning more about the why, learning about advanced pathophysiology, learning about advanced pharmacology, advanced physical assessment? Do I want to do that? Are you seeing people doing that? And you're like, how did they just do that? I want to be able to do that. I think that's when you know, okay, I'm ready for this next step. It may not be in a year, but you can really start to carve out that pathway. The other thing I would say is don't rush the nursing experience. So I see also new grads going into the NP didactic training with very minimal RN experience, and they just are missing that nursing intuition. They're missing that gut feeling of like, this patient's not stable. There's something going on here. I don't know what it is, but I need to pull in a colleague. I need to collaborate. I need to elevate the level of care. So I really would say don't rush the nursing experience, but don't stay in a position where you're crying every day. I did that as a new grad because I think we all did that as a new grad because we thought, okay, I got to pay my dues. And I
Pay
worked
my
in
dues, yeah.
long-term care for a year, and it was just soul crushing because for me, really having that patient experience is so important. I love to connect with my patients, and most of my patients were not responsive. And to me, I was like, this is not the nursing care that I want on a day to day. So, really starting to explore different options. So, you and I talked about it doesn't just have to be bedside, right? There's so many different nursing, like you can go into lactation, right? So, do you want to shadow lactation consultant? That's an advanced practice registered nurse. You have to get certified in that. There's certifications you could do. Do you like working with the geriatric population? Do you like home health? Really starting to explore those nursing roles because then you'll know where you're going to focus your advanced practice and don't rush it, but start planning for it, I think is the best way to do it.
Love that. Start planning for it. And I think really starting to think about the why behind things instead of just, I'm following a checklist. I have this set of orders. Well, why do I have this set of orders? What am I expecting to see with this set of orders? That's kind of a first step you can take in really challenging yourself that direction. Another thing I picked up on, Hiva, that I would love to dig into is what's the scope of the experience that you have? You can have a nurse that's done 5 years in a very specific unit. Let's say, for example, the neonatal intensive care unit. You have a very specific patient population there, and that's what you've seen, and you've mastered it, and you're feeling really good about the why behind that. But there's a whole lot else
Oh,
out
world of
there. So,
nursing, yeah.
so I always lean towards not like people ask me all the time, like, okay, Morgan, how many years of experience do I need? And you're going to get a different answer from everyone under the sun. I won't even bother giving you a number because it's kind of pointless at this point. I know that's like the answer everybody wants is like, you have to do 2 years. But I mean, why put a number on it? Because it's not about the number of years, but it's about the quality of experience. And I think also the breadth of
Yeah.
experience that you've gotten within those years. So I trained in a pediatric float pool where I went from mother baby to L&D to the ICU, the cardiac ICU, the emergency department. And I was not an expert at any one slice of
Yeah.
pediatrics, but I had a really broad exposure to pretty much anything that could or would
Yeah.
happen in a pediatric patient throughout, newborn to 20, 22
Wow.
years old. So when I then moved forward to take the next step and become a pediatric nurse practitioner, again, I wasn't a NICU expert or a bone marrow transplant expert, but I had been exposed to almost everything that we were learning about. And then I got to take it a level deeper. And I felt far more prepared because of that variety of experience that I
I love
had.
that, Morgan. So what I'm hearing is the variety helps and the quality helps. So you were at quality institutions where you really saw the way that it looks or it should look. And you knew from
Yeah.
there, like, what do I like? What do I don't like? There are people who are so, like you said, a small sliver of nursing, and they're like, nope, this is for me. I love it. This is what I want to do. We need those neonatal nurse practitioners. Fantastic. 100%. But for people who are feeling stuck, maybe it's because you've really just seen one little sliver. I like that. So get some variety in your nursing. You can go into oncology, you can go into research, you can do so many things in nursing and start playing around with it to see what's out there and what doors are open to you because there are a lot of doors and you just have to knock.
Oh, I love that. So many doors you just have to knock. So true. That's great. So, we first talked about getting really clear on what the role looks like, making sure it's right for you. And then, secondly, checking that foundation. There's not a magic number of years of experience, but really looking at how deep that experience has gone, thinking about the why behind things. But another thing to consider, the third bucket to talk about here, is how big of a load this is. And if you realistically are at a place in your life where you feel like you can carry that, going back to nurse practitioner school is not a small feat. It takes time. It takes a lot of mind share. I mean, your mental capacity, you've got to be able to dedicate to that. Sometimes there is travel required if you're going to a school further away. And then there's the financial reality that these degrees are oftentimes quite pricey. So Hiva, talk to us a little bit about the life and the money and the juggling and like how did you get prepared for that? How will students know, hey, I really want this and I think I'm ready for it. Can I realistically do
I love
this?
that. So here's my personal opinion. If you want something badly enough, you will do it and you will dedicate your time to it and you will dedicate and you will figure it out. And the reason why I say that is because I saw so many of my colleagues who just went into NP school just because of those similar reasons, like, oh, it's the next step, it's something to do, it's a good career, but it wasn't lighting them up. And so what ended up happening is it's a lot of work to get into NP school. You have to do a lot of legwork, applications, interviews, getting to the program, starting the program, maybe some prerequisites. And to put in that level of effort and then get there in that first year and be like, this is not right for me is just so devastating, right? So I would say if it's truly what lights you up, you've shadowed, you know exactly what patient population you want to work with, or you know that it's generally you want to do something in outpatient community health with families, kiddos, adults, you generally have a good idea. You find a supportive program, you can make it happen. And it is a huge lift. I mean, I lived in the hospital. My hospital was attached to the medical school that had a graduate school within it that had a really nice medical library. And I was lucky at that time I didn't have kids. I was dating my now husband, so I could live in the library. And that's what I did. I lived in the hospital. I mean, the cafeteria knew me, and that's that I got a small little apartment literally behind the hospital that I shared with one medical student and one other student in my cohort. And I lived and breathed NP school and work. Like I literally went from class to work to the library, and that was my life, right? And so you also have to really be thinking about what is that going to look like, that level of dedication, if you're going to do it well. And please do it well because you will regret it if you don't put in the time and the effort when you're in your training. Because when you get out there, it's it's a it's a transition. I think that's the nicest way to put it.
For sure. I could not agree more, Hiva. The first thing you said was, if you really want this, you're going to find a way to make it happen. What I would like to add is that think about how you're going to make it happen before making the commitment.
Yes.
Kind of do a time audit, look through your current obligations, your schedule, your partner's schedule, your kids, like really think like practically, logistically about where this is going to fit into your life. Because Hiva's 100% right. If you want it, you can make it happen. But I believe in setting yourself up for success, like really planning for that rather than winging it. And I'll also add there are many different options as far as full time, part time. There's some all in person versus remote versus hybrid. So really explore what those options are to see what will fit in your life and make sure that realistically this is something you are going to be able to do and do well. Like Hiva said, the last thing you want is to only, give it half your effort, because it is so important. And on that note, I know this is a subject of passion for Hiva, so I want to make sure we save time for it. You're looking at these different types of programs, figuring out what fits in your life. Am I going online, in person, etc.? I think it would be irresponsible of us for not mentioning not all NP schools are created equal. The quality and just the fit into your life is not apples to apples. There's a lot to take into consideration. So if you have made it this far in the episode, you're like, I'm clear. This is the role I want. I'm ready for it. I'm in the right mind space. It's going to fit into my life. You're ready to apply. The next thing I would say to think about is the quality and fit of the program. There's so much to talk about. I'm going to hand it over to Hiva because I'm sure she's going to need some time to dig into that.
So I was just thinking this is such a good segue because one thing I was going to add to planning, you're absolutely right, Morgan. I think you're a great planner. Just seeing that from a leadership perspective, I think planning is 100% the way to look at it, because you're not going to be able to do it on your own. There's just no way. And you need to have a team to support you. And part of that is picking the right NP program. And I'll get to that in a minute. But one thing I wanted to touch on is you really have to set up that team around you and make sure you're setting yourself up for success. So when you have,
Love
like,
that.
for example, my job encouraged me to go back to NP school, and they worked around my schedule. They were flexible with the shifts that they gave me so that I could attend class in person and I could get my work done. That was really important, right? And then my second year, when it got really heavy, they actually transitioned me to a different clinic where I did more of a leadership role. I looked at more processes in the clinic so that it gave me time to really be able to focus on my didactic studies as well. I wasn't drained running around in the clinic all day, but it was more of a leadership role, which is really what advanced practice is as well. So it was really setting me up for success. And then the program itself. So really, you're not doing this by yourself. So we talked about how you really need to talk to your employer. They need to support you with how your schedule looks so that you can attend those classes. But the same with the program. So I'll give you an example of DNP. So I was in the DNP track originally. Life happened. I stepped away at the MSN and started practicing. And I think actually it was for the best. It really taught me that I need to really be more mindful about the degree that I'm going back into. And that's what we're talking about today. Is it the right degree? Do you need to really invest that time? And I think now I actually reached out to my alma mater, talked to them about all the great work I'm doing here at Archer, what we're doing with scope of practice and improving NP education. And DNP now just makes more sense for me. And because they're based all the way in Massachusetts, they are a quality program, and they're like, well, let's create a plan for you. And they're really going to come up with how I can take these courses, even though they meet in person. They're like, well, I don't see why you couldn't do it remotely. And we would be able to do X, Y, and Z remotely. And then this one, you'd have to be in person. So even programs will work with you if they're quality programs, because they're going to help you get across the finish line. And that's what's really important. So you guys have probably heard me say this again, but talk to people, right? And it may not come naturally to some people. It comes naturally to me, but I always like to reach out and say, hey, this is what I'm considering. Would you mind spending some time talking to me about it? So if you're thinking about the NP track and you're thinking about a specific patient population, reach out to a couple of NPs. If you're really thinking about it seriously, talk to your employer, talk to your nurse manager, have someone on your side who knows your goals and can help you cross that finish line while you still maintain your job and your income, because it's expensive. And then talk to the programs and see really what is the level of support they're able to give you. Is there flexibility with how you can take the classes, in what order you can take the classes? Are they going to set you up with clinical preceptors, or is that something you have to explore on your own? So talking to people, you get such a good sense of like who's going to be on your team to get you across this finish line. That's really important.
So important. You're absolutely right. We're not doing it alone. We say to our students every day, it takes a village. So build your village.
Yes.
And those people can help you navigate, not only is this a quality program, but is it the right program for me? So you're going to want to look at things like, are they accredited? Who are they accredited through? What do their board pass rates look like? If the majority of students are not passing their boards, that should be a big red flag that the program is not quality and that should not be on your list. I think we also should dive in a little bit to clinical placements, like Hiva brought up. This is a big topic of debate in NP education. I know for me, I had to find my own clinical placements. And if I had been living at home where I was a nurse for years, that would have been pretty simple for me. I had a lot of connections, I knew people, not a big deal. As it so happens, though, I had moved many states away and I was living somewhere where I didn't have any connections. And finding preceptors who were willing to take me was a massive, massive challenge. And there are many other NP students that can relate to this challenge of finding preceptors. There is a shortage of preceptors. They're also precepting medical and PA students. So there's just like a lot of students who need preceptor hours. And it's super hard. So, Hiva, I think that was a great point to bring up. Ask that question. And if they're placing you at clinical sites, that's a great green flag that you've got a quality program.
Yeah, I think you bring up an important point, Morgan. So not only do you not have those connections, but the whole point of the precepting of those clinical rotations is to give you that breadth. So if you already had that breadth, then you wouldn't be relying on a program to go back and help you with those preceptors. The other thing is, you bring up a great point. We do have a shortage of preceptors, but even the people who are willing to take you, what is their training with precepting? How are they precepting you? We're seeing that a lot in NP education, that there has to go in there's now training programs for NP preceptors so that students can benefit from that clinical rotation, right? Are you just there just shadowing the person? Are you there getting real experience where you go in and see the patient and then come talk about the case and then write up your note and then talk about the note? Or are they using you as free labor? I have students who say, yeah, I worked at so and so clinic. It was great. I saw everything, but I got zero feedback. And that's not a clinical rotation, right? Like if you didn't need feedback, you wouldn't have to do these clinical rotations, right? So the whole point of it is to really get that meaningful, what we talked about, the quality is really important. So talking to those programs, getting a better sense, talking to students who've gone through programs, seeing those pass rates, it's really, really important to do your legwork.
Absolutely. And I think Hiba hits on a good point of it's the quality, not the quantity of students that go through the program. If the program is boasting things like, we graduate 500 nurse practitioners a year, to me, that would be a red flag to like really dig into at least maybe a yellow or an orange flag and be like, well, how many of them are passing? What are their new grad experiences like? Are they getting jobs? That's the other thing to ask. Like, how many of your graduates then are successful in obtaining a new graduate nurse practitioner role within, say, a year? It often doesn't happen right after graduation, like it does mostly for nursing students. It sometimes takes a little bit longer in my experience. But if everyone's graduating, they're not passing their boards or they're not getting a job, then that's really not the outcome that you're looking for. So those are two really critical things to dive into. And again, it's about finding the quality program, not a program that's just focusing on quantity of students in and out.
100%. Yeah, you don't want a diploma mill. That's scary. And I see students coming to us and saying, "Oh my gosh, like I need help," and it's not their fault. It's the system, it's the program. So don't set yourself up for success. I like what you said, Morgan. Plan, but think about the details that we talked about today and really set yourself up for success. Yeah.
I love it. I love it. Well, let's kind of recap our key takeaways here. We walked through a few buckets kind of in order. The first thing we talked about was get really clear on the role and make sure that the role you are considering pursuing is something you can see fitting into your day-to-day life and that you're really excited about. Number two, make sure that you're setting your foundation up for success. And this is something you can do right now, even if you know you might not be ready to apply for a couple of years. Hiva talked about really digging into the why, asking those deeper questions, and getting a good breadth of experience so that you have that clinical background to pull on, because that's going to be a huge asset to you as you further your education. Third, we talked about really making sure that you can carry this load, get really practical about how am I going to fit this into my life? What am I going to do to set myself up for success here? Because as Hiva said, it's a huge commitment.
Yeah.
And gonna do it, you need to do it right. So think through those little nitty-gritty things, including thinking about a quality program. Ask those questions about pass rates and accreditation. Think about the preceptor situation so that you're really finding a program that's the right fit and the right fit for you. Hiva, thank you so much for joining us today on Pulse Check. We so appreciate your time and your expertise. I know there are many future NPs that have really benefited from this episode.
Thank you, Morgan. It was my pleasure. And I will add one more note. I love the topic of this episode because should you apply to NP school? And I love that you've opened this conversation up because there are so many options and the NP track is not right for everyone. So really look at clinical leadership roles, look at those other options in education and administration, and really think about at the core, what is it mean to be a nurse practitioner, and is that what you want? So I really welcome the topic of today's conversation, and I love being on today's podcast with you. So thank you for having me.
Wonderful. Thank you, Hiva, and thank you to all of you for listening. We will see you back next time here at Pulse Check. All right, future nurses, that is a wrap. If you found this pod helpful, I'd love to continue supporting your nursing journey through nursing school, the NCLEX, continuing ed, and beyond. Archer Nursing has you covered with on-demand video lectures, high-yield question banks, live case study reviews, and so much more. We want to help you master tough concepts and make it fun. So join us over at archerreview.com. Follow us on socials at Archer Nursing for more free nursing tips and study resources. Thanks for tuning in to Pulse Check with Archer Nursing. I'm Dr. Morgan Taylor, and I'll see you back next time.